In this lesson, we will review the instructions on how to advance a service member through the stages of the PRA. By the end of this video, you will be able to effectively communicate the criteria for progression in the PRA to a service member. All concussed service members must go through the PRA stages in a stepwise fashion and pass a return to duty screening before they can return to full duty. They must spend a minimum of 24 hours in each stage. The PRA is a patient-directed process. The provider should take extra time to educate the patient on how to advance through the stages of the PRA. The Patient and Leadership Guide includes these instructions and should be given to the patient when they begin the PRA protocol. The service member should assess their symptoms at the beginning of each day by simply asking themselves whether they feel the same, better, or worse than the previous day. If their symptoms are the same or better when compared to the previous day, and they do not have any new symptoms, they should attempt increasing their physical and cognitive activity and advance to the next stage of the PRA. If they indicate that their symptoms are worse, or if they have any new symptoms, they should remain in the current stage for an additional 24 hours. So, for example, if a patient spends 24 hours in stage 1, relative rest, and the next day they feel the same, they should still attempt to do the increased physical and cognitive activities in stage 2. This reflects new evidence that promotes introduction of early symptom-limited activity to expedite concussion recovery. If a service member experiences worsening symptoms when attempting to advance, they should stop the activity and utilize the guidelines for relative rest until the exacerbation resolves. Then return to the previously tolerated PRA stage for the remainder of the day. So, using the same example, if the patient attempts to advance to stage 3 and experiences worsening headache while riding a stationary bike, they should stop the activity and utilize the guidelines for relative rest until the headache resolves, and then return to stage 2 for the remainder of the day. The service member should follow up with their PCM every 3 days to ensure close observation during the PRA process. Consider utilizing telehealth appointments with the PCM or a trained support staff member to complete these follow-up visits. However, keep in mind that the return to duty screening will require an in-person appointment. We recommend scheduling 5 follow-up visits during the first appointment. This will ensure access to care and allow the service member to provide the appointment dates to their chain of command for planning purposes. If the service member does not advance through a single stage for 3 consecutive days, first, confirm that the service member has been compliant with the activity recommendations in that stage. Then, refer to the symptom-guided management table for information and resources on how to treat common post-concussion symptom clusters. If symptoms persist for more than 15 days, consult the specialty referral guidance table to refer the patient to the appropriate higher level of care. See video number 7 for additional information about when and how to use the symptom-guided management and specialty referral guidance tables. In this video, we reviewed the criteria for progression through the stages of the PRA and touched on follow-up guidance. A more detailed description of each of the PRA stages is coming up in video number 5. Before watching the next video, we recommend that you review the algorithm again, taking time to navigate to each superscript for additional details, and read the FAQ document, which answers frequently asked questions.